It is being called a growing crisis. Canada is critically low on family physicians, and millions are turning to walk-in clinics. But we now know wait times are skyrocketing across the country, and doctors tell us relying on walk-ins isn't a sustainable solution.
We're in a bad situation, and I don't see a light at the end of the tunnel.
We're told it could be the key to relieving a healthcare system under immense pressure.
Every Ontarian having their own family doctor, that would make a world of difference.
But finding a family doctor is about to become even more difficult. It's estimated by 2025, 1 in 5 Ontarians may not have one.
A lot of doctors on the supply side are basically saying, I'm burnt out, I'm not compensated well enough, the work-life balance isn't there, so I'm leaving.
The impact already being felt today, not only contributing to overflowing emergency rooms, but burdening walk-in clinics too. On average, patients in Ontario had to wait 25 minutes to see a doctor at a walk-in clinic last year. Doesn't sound so bad, but that's up 66% from the year before, when the average wait was just 15 minutes, and up 108% since 2019, before the pandemic, when the average wait was 12 minutes. And Ontario is doing better than the rest of the country. Within Ontario, Brampton had the best walk-in wait times, while patients in London were waiting the longest.
Clearly, the demand is outstripping supply, and I think that's going to get worse.
And public health experts say even if wait times were to improve, increased demand for walk-ins is a troubling sign.
While it's convenient and might be useful to get a prescription, for example, for an infection or something, walk-in clinics are not the perfect place to receive kind of ongoing care for chronic conditions and the complex conditions that increasingly we see in the population.
The Ford government has committed to opening more family medicine residency training spots and streamlining licensing for internationally trained physicians. But the Ontario College of Family Physicians tells us that will take time. They say their solutions can be implemented immediately and include improving working conditions to retain current family physicians.
There should actually be an improved pay scale for people who work within the office.
And backing family doctors up with a team to assist with things like time-consuming administrative tasks.
Colleagues of mine have said that they spend up to 19 hours a week doing administrative tasks. That's almost half of most people's work week.
75% of family doctors in Ontario currently do not work in team-based practices.
And that means they have to run a lot of their practice, and that means less time with patients.
If solutions are implemented today, the College of Physicians says Ontarians could see results within the next 2 years. For City News, I'm Tina Yazdani.